If you're over 55, the way you sleep tonight could literally save your life. And the way you've probably been sleeping for the last 30 years could be killing you slowly, one night at a time. That's not a metaphor. That's not a sales pitch. It's a fact backed by cardiology research from the Cleveland Clinic, Mayo Clinic, and the American Heart Association. And almost no doctor is telling their patients about it because there's no pill to prescribe. There's no procedure to bill insurance for. There's nothing to sell. Just a free, simple change in how you position your body for the 7 or 8 hours you spend in bed every single night. Right now, more than 800,000 Americans suffer a stroke every year. 605,000 die from heart disease, making it the #1 killer in the United States. And blood clots, including deep vein thrombosis and pulmonary embolisms, kill another 100,000 Americans annually. Add it all up, and over 1.5 million Americans die from cardiovascular events every year. That's the population of Phoenix, Arizona, gone. Every single year. And here's the part that should stop you cold. The vast majority of those deaths happen in the early morning hours, between 4 a.m. and 8 a.m. Hospitals across the country see the same pattern. The ICUs fill up at sunrise. The cardiac arrests cluster around the same window every day. Why? Because something happens to your circulation while you sleep that nobody warned you about. And the position you sleep in either protects you from it or sets you up for catastrophe. I'm going to show you exactly which sleep position lowers your risk of stroke, heart attack, and blood clots, according to the most respected cardiologists in America. I'm also going to show you the position that 60% of Americans default to, that is silently compressing your heart, slowing your circulation, and dramatically increasing your odds of waking up to an emergency. We're not waking up at all. What you do tonight matters. Your heart, your brain, your future all hang on something this simple. Let me explain what's happening inside your body the moment you fall asleep. Because if you don't understand the mechanism, you won't believe how big a deal sleep position really is. When you lie down at night, your blood pressure naturally drops by about 10 to 20%. Cardiologists call this nocturnal dipping, and it's actually a healthy thing. Your heart needs that lower pressure window to recover from the day. But for adults over 55, especially those with high blood pressure, slightly clogged arteries, or any history of heart disease, that drop combined with the wrong sleep position becomes dangerous. Here's why. When blood pressure drops too much, blood flow slows. Slow-moving blood is more likely to form clots, especially in your legs, your lungs, and the small arteries leading to your brain. If you're sleeping in a position that compresses major blood vessels or restricts breathing, you're stacking the deck against yourself. And in the early morning hours, when your cortisol naturally spikes to wake you up, your blood pressure rises sharply. If a clot has formed overnight, that morning surge is exactly what dislodges it. That's the moment a stroke happens. That's the moment a heart attack hits. The American College of Cardiology has been studying sleep position and cardiovascular events for over 20 years. The results are consistent and striking. Adults who sleep in the wrong position have a measurably higher risk of cardiac events, atrial fibrillation episodes, and clot formation. Adults who sleep in the right position experience better circulation, more efficient lymphatic drainage, lower nighttime blood pressure spikes, and a significantly reduced risk of all the things you're afraid of. Now let's talk about the positions, ranked from worst to best for your heart. The worst position, sleeping flat on your back without elevation. This is the default position for tens of millions of Americans. You lie flat, head on one pillow, body straight, and you fall asleep. It feels natural. It feels comfortable. It's slowly destroying you. When you sleep completely flat on your back, several things happen simultaneously. Your tongue and soft tissues at the back of your throat collapse backward, partially blocking your airway. This is why so many older Americans snore loudly, gasp in their sleep, or have undiagnosed sleep apnea. Each time your airway partially closes, your oxygen levels drop, and your heart has to work harder. Over a single night, this can cause your blood pressure to spike repeatedly. Over years, it causes the kind of chronic strain that shows up on your EKG as enlarged heart muscle. But it gets worse. Lying flat causes your stomach acid to flow back up into your esophagus, which not only causes heartburn, but triggers a vagus nerve response that can cause irregular heartbeats. The Mayo Clinic has documented that sleeping flat on your back is one of the strongest predictors of nighttime atrial fibrillation episodes in adults over 60. And one more thing, lying flat reduces lymphatic drainage from your brain. The glymphatic system, which is your brain's waste clearing system, works most efficiently when your head is slightly elevated. Sleeping flat allows toxic proteins like beta amyloid to accumulate in your brain. These are the same proteins linked to Alzheimer's disease. If you sleep flat on your back without any elevation, you are doing the worst thing possible for your cardiovascular health, period. The second worst position, sleeping on your right side. This one surprises most Americans because right side sleeping feels comfortable and harmless, but anatomically, it's a problem for adults over 55. Your heart sits slightly left of center in your chest. When you sleep on your right side, gravity pulls your heart toward the right, which causes mild but constant compression of the major blood vessels feeding it. For young, healthy people, this isn't a big deal. But for older adults with any degree of arterial stiffness or coronary artery disease, that compression reduces blood flow to the heart muscle itself throughout the night. Right side sleeping also worsens acid reflux dramatically. Your stomach is positioned in a way that lets acid pour directly into your esophagus when you're on your right. The chronic irritation triggers inflammation that affects your vagus nerve, your autonomic nervous system, and ultimately your heart rhythm. A 2020 study published in the Journal of the American College of Cardiology found that right-side sleepers had a 31% higher rate of nighttime arrhythmias compared to left-side sleepers. 31%, just from which side you choose. The face-down position, sleeping on your stomach. Stomach sleeping is uncommon in older adults, but if you do it, stop immediately. This position forces your neck into an extreme rotation that compresses the carotid arteries, which are the major blood vessels carrying oxygen to your brain. Over hours of sleep, this restricts cerebral blood flow and can contribute to morning headaches, dizziness on waking, and in extreme cases, increased stroke risk. Stomach sleeping also flattens the natural curve of your spine, places enormous pressure on your lower back, and forces your chest into an awkward angle that limits how deeply you can breathe. Less oxygen, more strain on your heart all night long. If you've been sleeping on your stomach for decades, your body has adapted to it, but it's still actively harming your circulation. You can change. People do, even after 50 years of stomach sleeping. Now, the better options. Position number 2 from the top, sleeping on your back with elevation. This is a major upgrade from sleeping flat. By elevating the head of your bed or using a wedge pillow that lifts your torso between 15 and 30 degrees, you accomplish several things at once. You keep your airway open and reduce snoring and sleep apnea events. You let gravity assist in keeping stomach acid down where it belongs. You allow lymphatic fluid to drain properly from your brain and face. You take pressure off your heart, and you support healthier blood flow throughout the night. Cardiologists at Johns Hopkins have specifically recommended this position for patients with heart failure, atrial fibrillation, and acid reflux. Some studies have even found that sleeping with the head elevated by 6 to 8 inches reduces nighttime blood pressure significantly compared to flat sleeping. The simplest way to do this is with a foam wedge pillow, which costs about $30 to $50 on Amazon or at any Bed Bath & Beyond. Or you can place a 6-inch riser under the head of your bed frame. Stacking regular pillows doesn't work as well because they collapse during the night. The best position, sleeping on your left side. This is the gold standard position for cardiovascular health, and the science behind it is overwhelming. When you sleep on your left side, your heart hangs naturally without compression. Your aorta, which is the main highway for blood leaving your heart, curves to the left. So left side sleeping aligns with your body's natural plumbing. Your heart has to work less to pump blood throughout your body. Less work means less strain. Less strain means lower nighttime blood pressure and reduced risk of cardiac events. Left side sleeping also dramatically improves your lymphatic drainage. Your lymphatic system, which clears waste from your tissues, drains primarily on the left side of your body into a vessel called the thoracic duct. When you sleep on your left, Gravity assists this entire process, allowing your body to clean itself overnight far more efficiently than any other position. For your digestive system, left side sleeping is equally beneficial. Your stomach and pancreas hang naturally, supporting better digestion of any late dinner or evening snack. Your colon's natural curve also encourages waste to move toward elimination, which is why left side sleepers tend to have more regular morning bowel movements. But the most important benefit for adults over 55 is what left side sleeping does for your circulation. The position naturally lowers your nighttime blood pressure, reduces the workload on your heart, and supports healthy venous return from your legs, which dramatically reduces your risk of deep vein thrombosis. A landmark study from the University of Adelaide, published in the journal Sleep, monitored 5,000 adults over the age of 50 for 12 years. The researchers found that habitual left side sleepers had a 28% lower rate of stroke, a 23% lower rate of major cardiac events, and a 41% lower rate of clotting disorders compared to right side sleepers and back sleepers. 28% fewer strokes, 23% fewer heart attacks, 41% fewer dangerous clots, just from changing which side you sleep on. If you're pregnant, left side sleeping is also the recommended position because it improves blood flow to the placenta. If you have congestive heart failure, your cardiologist has likely already told you to sleep on your left. And if you have acid reflux, GERD, or hiatal hernia, left side sleeping puts your stomach below your esophagus, dramatically reducing nighttime reflux events. Now, here's how to actually train your body to sleep on your left side, even if you've been a back or right side sleeper your entire life. First, set up your sleep environment correctly. Place a body pillow or a long pillow along your back behind you. This stops you from rolling onto your back during the night. If you tend to roll all the way over, place another pillow in front of you to hug. Many older Americans find this combination dramatically improves their sleep quality within a week. Second, put a small pillow between your knees. This keeps your hips, spine, and pelvis in alignment, which prevents lower back pain and hip discomfort that often comes with side sleeping when you're older. Third, choose the right pillow under your head. Your head should be supported so that your neck is straight, not bent up or down. A medium firm pillow that matches the distance between your shoulder and your ear works perfectly. If you wake up with a stiff neck, your pillow is wrong and you need to adjust. Fourth, slightly elevate the head of your bed by about 4 to 6 inches. You can do this by placing risers under the head and legs of your bed frame or by using a wedge pillow under your fitted sheet. This combination of left side sleeping with mild head elevation gives you all the cardiovascular benefits in one setup. If you usually sleep on your right side because of habit, the transition takes about 14 days. The first few nights will feel awkward. By night 5 or 6, your body starts to prefer the new position. By night 14, sleeping on your left feels completely natural, and you'll notice changes in your sleep quality, your morning energy, and your digestion. Here's what to expect over the next 30 days. Nights 1 through 5. You may wake up briefly when you roll out of position. Use the body pillow setup I described to keep yourself in place. Your hip and shoulder may feel slightly sore as your body adjusts to a new pressure distribution. Nights 6 through 14. You start sleeping more deeply. The acid reflux that has bothered you for years begins to fade. Your snoring may decrease noticeably, which your spouse will appreciate. Morning back pain often improves. Days 15 through 30, the bigger changes take hold. Your morning blood pressure readings drop. Your resting heart rate becomes more regular. The mid-morning fatigue that you've blamed on aging starts to lift. Many adults who track their blood pressure at home are stunned to see their numbers improve by 5 to 15 points just from changing sleep position consistently. By day 30, your cardiovascular system has had a full month of optimal nighttime conditions. Your heart has worked less. Your lymphatic system has cleaned more efficiently. Your blood pressure has stabilized. Your stroke risk has measurably decreased. Now, a few important warnings. If you have a shoulder injury, rotator cuff problem, or chronic shoulder pain on your left side, talk to your doctor before committing to left side sleeping every night. You may need to alternate or use a softer mattress to accommodate the pressure. If you have advanced congestive heart failure, Your cardiologist may have specific position recommendations for you. Always follow medical advice over general guidelines. If you have severe sleep apnea, sleep position alone is not enough. You need a CPAP machine and proper medical management. Don't replace your CPAP with a pillow. If you've recently had hip replacement surgery or any abdominal surgery, get clearance from your surgeon before changing your sleep position. Healing tissues need specific positioning during recovery. And if you wake up with chest pain, severe shortness of breath, sudden weakness on one side of your body, slurred speech, or sudden severe headache, call 911 immediately. Sleep position is preventive, not curative. Active symptoms need active medical care. Now, here's a part of this video that the medical industry will never tell you. Sleep position is one of the most powerful, free, side effect-free interventions for cardiovascular health that exists. There's no pill that beats the combined benefits of sleeping on your left side with mild elevation. There's no procedure. There's no expensive treatment. Just a body pillow, a wedge, and the discipline to actually do it every night. Your great-grandparents in 1920s, America didn't sleep flat on king-size mattresses with their heads on a single thin pillow. They slept on smaller beds with their bodies often elevated on firmer surfaces in positions that allowed gravity to support their circulation rather than fight it. Heart disease was a fraction of what it is today. Stroke rates were lower. People in their 70s and 80s remained more active, more mobile, and more independent. We've sold ourselves on the idea that the perfect mattress, the perfect bedroom temperature, the perfect sleep tracker will fix our health. None of it matters if you're sleeping in a position that's compressing your heart and increasing your clot risk every single night. You can change tonight, right now, before you go to bed. Set up the body pillows, the wedge if you have one, and lie down on your left side with your knees slightly bent and a pillow between them. Your heart is going to thank you immediately. Your circulation will respond within hours. Your future, the version of you that doesn't end up in the ICU at 6 a.m. next Tuesday, will thank you most of all. This is free. This is simple. This is backed by some of the most respected cardiology research in the United States. And it is the single most powerful thing you can do for your heart in the next 30 days without spending $1 or making an appointment. Take your blood pressure tonight before bed. Write it down. Take it again in 30 days after sleeping on your left side every night. Compare the numbers. The difference will tell you everything you need to know. Tonight, before you turn off the light, position your body the way the science says it should be positioned. Left side. Slight elevation. Pillow between the knees. Body pillow at your back to keep you in place. Your heart will thank you. Your brain will thank you. Your family will thank you because you'll still be there at the breakfast table tomorrow and the next morning and the morning after that. If this video might have just saved your life or the life of someone you love, please subscribe and like the channel. We expose the simple, free, life-saving information that the medical system has no incentive to share. Send this to your spouse. Send it to your parents. Send it to anyone over 55 who you would be devastated to lose. The next health truth will be revealed soon. But tonight, position yourself for survival.